Well, as the number of cases of coronavirus rise around our area, we continue to look for ways to improve our own health. How can we become stronger and healthier to lessen the impact of this or any other virus? Here to continue our conversation on becoming the least vulnerable is Dr. Todd Muncy. And Dr. Muncy, thanks again for joining us.
Thank you for having me. And again, let me give a shout out to the medical professionals on the front line. They're doing an amazing job.
Absolutely. And one of the things that we can do is try our best to keep ourselves as healthy and as strong as possible. And you say, you know, there are some things that we can really be doing to change those.
Absolutely. We can start to look at things, you know, that go wrong with our health, like cardiorespiratory problems, you know, getting out exercising, because that seems to be the biggest population affected right now, is people with cardiac health issues or respiratory health issues, especially in the lower lung region, like asthma and things of that nature. So these people want to do things to keep themselves healthy, exercise, expand that ability, and start to get blood flow going through their body more normally than they are at this time. Now, there are genetic things that go on with these people that cause those problems, but they can still improve upon what they have presented to them at the time.
So making those changes in lifestyle and those daily activities over time, you say, can really have a big impact.
Absolutely. Lifestyle plays a huge role in any health crisis that we have in the United States. And again, talking about cardiorespiratory, you know, lifestyle changes that you can make there is eating right, exercising well, also posture. A lot of people ignore posture in this realm of health, but excuse me. The posture plays a huge role in how our body's affected and how it deals with its environment.
And when you say posture, what is the correct posture? I'm thinking about people at work and at offices and things like that, and having that toll taken on your body.
Well, it does take a toll on your body, and we end up slouching, getting in poor posture, but you have all kinds of deviations in posture. Posture is just the body indicating that it has a structural weakness. You know, people that have postural issues, you can see them. You just do simple tests to find them out. But people with postural issues, especially in the thoracic region, can start to put pressure on their diaphragm and start to cause a host of health problems.
And when you say that, it makes me think about just that thing of breathing, the things that we take for granted every day, and you get those shortness of breath because you're not getting that deep breath that you're supposed to be getting.
Absolutely. That's how we get oxygen into our blood and get it around to the rest of our body, is being able to take those deep breaths. But it also affects a lot of other things in that region, you know, especially when we get in that slouch position. You know, we have the heart, lungs, everything else is affected by the neural output in that region as well. So having proper posture there helps. Now, there was a study done a while back. I'm going to read it to you, the kind of a synopsis of it, but his name was Dr. Freeman. He's from the Journal of American Medical Associates. He's actually from Harvard. He wrote in the Journal of American Medical Associates that aging spinal disc caused postural deviations, leading to intestinal diverticulum, hemorrhoids, varicosities in the legs, osteoporosis, hip, foot pain, and those were all the pain symptoms. But he also added at the end of that, overall poor quality of health. And when we're dealing with something like what's going on in our world today, we definitely don't need to have those structural malpositions interfering with our health, because we want to be as healthy as possible.
Now, when you're talking to your patients and maybe our viewers out there, can you give us some tips when it comes to good posture? How do we know if we have good posture?
Absolutely. So good posture, you want to look at yourself. It's real simple. You can use a loved one, or you can look in a mirror and you can start to look at the way your body's lining up. Unlevel shoulders, similar to what I've got showing you here, or a head tilt, something of that nature, or the rolled forward shoulders, which puts us in a kind of a depressive posture. Being in that posture actually causes us to weaken our immune system too, because depression and poor mental input or poor mental output can affect the way we feel and make us sicker. But if you want to know things that you can do to improve your posture, there's certain exercises and things, and these are widely available out there on the internet on postural, you know, reconstruction. But also coming in to the chiropractor's office, letting us do an evaluation of you, see where these structural malpositions are, and work out a plan to correct them over time.
Yeah, certainly everything is connected and it all works together, doesn't it?
Absolutely.
All right, well, some great information. I think you have me and the rest of our viewers at home wondering exactly how we're standing. We're all looking at our posture now. Great information. Thank you so much for joining us today.
Thank you for having me today.
All right, if you have any questions or you would like to get in touch with Dr. Muncy, here is that information. You can do it at this website, this address, or go ahead and give that office a call.